COVID-19 is surging once again in Alberta. As it is everywhere across the country and most of the world, the Delta variant of COVID-19 is causing concerning rises in hospitalizations in our province, almost entirely amongst unvaccinated Albertans. COVID-19 vaccines continue to provide amazing protection against infection and severe disease, even with the Delta variant. So I'd like to thank the 2.9 million Albertans who have chosen to roll up their sleeves. Yesterday, we reached the critical milestone of having 70% of our eligible population fully vaccinated. That's to say 70% of Albertans aged 12 and over. 78% of eligible Albertans have received at least a first dose. This is an important achievement, especially when you consider that Alberta has Canada's youngest population. But the bad news is that we still have 30% of the eligible population without full vaccine protection, that is to say, without 2 doses. And the Delta variant is ripping its way through this group at an aggressive rate. Today, we are announcing that Alberta will be the first province to offer a personal monetary incentive to step up and do the right thing. Anyone who gets a first or second dose will now be eligible to receive a $100 gift card.
Starting at 8 a.m. tomorrow, Saturday, September 4th, masks will again be mandatory in all indoor public spaces and workplaces here in Alberta. For workplaces, that means that employees must mask for all indoor settings except for workstations or where 2-meter physical distancing or adequate physical barriers are in place. This also means that masking on public transit will remain in effect until further notice. Masking in acute and continuing care was previously extended, so let me remind you that we must continue to wear masks at any of those facilities. Now, regarding schools, school boards will continue to set COVID management policies as they deem appropriate. The provincial mask mandate will not need to apply to schools. Masks will help slow the spread of the virus and the impact on the health system, and this is a step that we can take with minimal disruption of businesses and people's normal activities.
This is not a time for moral judgments. This is a time to get people vaccinated. We have done everything we can, left no stone unturned, made it as easy as possible. We're the first province out there with the big lottery. We've had a bus running around the province. We're the only province with a billing code that allows doctors to bill for proactively calling their patients who are unvaccinated to share medical information with them. We have left no stone unturned, and yet we have the lowest vaccination rate in Canada. We are about 5 percentage points below the Canadian average, and that is why we're getting hit harder. And if the choice is between a sustained crisis in our hospitals, or God forbid, widespread restrictions, which I want to avoid at all costs, or finding some way to get the attention of those vaccine latecomers, we're going to choose the latter. We're the only province to do it. It's worked in some of the U.S. states. I wish it didn't have to come to this. But I'm much more concerned about protecting our hospitals than I am about the message, some abstract message that this sends. The message it sends is a very simple message. If you've been holding out and you just haven't gotten around to it, it's now literally worth your while.